One day that I will never forget was the day that the Affordable Care Act was signed into law. Now, regardless of how you feel about this piece of legislation, there's several aspects I hope you will appreciate. First of all, the nursing profession was totally engaged in writing components, provisions for this law. And that was unheard of. It's a game changer. And so that's why today is important, because we can't let the momentum that we have earned disappear. One of the things that's remarkable is that many people don't realize this. You can Google this and you'll say, she's right. Is that in the 50s and 60s, the nurses recognized then that health care was a right. Not a privilege, a right. And so back in the 50s and 60s, we championed the creation of what is today Medicare. The docs were against it. The hospital associations were against it because they were afraid of what it could be. We were the only healthcare provider group that felt that it was so very important. And now today, lesson learned for us is that we helped get it passed, but we didn't stay engaged in the process once it got passed. You know, you pass the legislation, the president signs it, you go through the rulemaking process. Well, we sort of stepped back. We can't step back from any other pieces of legislation and the opportunities that we have to really help craft what it is. And so it's the timing of all this is incredibly good for us. The driver of what is considered for future issues in the nursing profession is the healthcare system. And that makes a lot of sense. We know that the healthcare system is undergoing a lot of changes, and people clearly understand that their future is going to be tied to some of those changes. Think about all the healthcare that's moving out in the community. So people are recognizing that. The other areas here then is the next largest one is the economics. That's a driver of what our practice is going to look like in the future. Think about the reimbursement, the payment systems. And there's a lot of uncertainties about that because of the economy and whether or not people, in fact, will be accessing some of the healthcare services because of their own personal financial situation. Education, the future. People are understanding that that baccalaureate degree is clearly an important part of their practice in the future. It's finally, we're at the point where it's no longer debatable as to why nurses should have a higher level of education. And then the science and technology. And that, of course, we all understand the importance of how that's going to be the driver for some of our future. Some of the apps that are being designed. It blows my mind as to things that are out there now for us to use in taking care of our patients. So how does that then impact our future policy needs? I mean, that's what you got to start thinking about. How does this impact not just how I practice as a nurse or how I provide care to my patients, but what's the policy implications here? So why should nurses be engaged? Well, I think I've told you several issues right now, but we are the largest group of healthcare providers, and more importantly, we have a front row seat every day when we take care of our patients. And more importantly, we have the intellectual capacity. I mean, I say this and people kind of like, I think we are incredibly bright. I'll even go so far to say is that nurses are some of the brightest individuals you'll ever meet. But here's the other part of this. It's our responsibility as a part of this profession. Not that I'd expect anybody in this room, unless you're in school, but our code of ethics is very clear about it. Our social policy, which is really our contract with society, our social policy talks about all of us. And as nurses, what our responsibility is. And I describe it as it's a contract. It's what we say we will do as registered nurses when we care for you. And in that document, it's clear to say we will advocate for our patients, for ourselves, and for the profession. And then the third document there is the scopes and standards. And that document's also very clear about the role of nurses being advocates. Now, the spectrum of our policy work is a place that I'd like us to sit here and think about for a minute. Because when you talk about policy and politics, that turns people off. It's the politics, it's the drama. The policy, I think we're okay with that, most folks. But I like to talk about it as little p and big P. The big P is the policy stuff in DC. It's the policy stuff in the boardroom, in the Capitol. The little p is policy that nurses do every day. It may be, something related to changing the hours that they work. And some of the same skills you use to impact the little p is what you use to impact the big P. You have a lot of nurses that will say, I can't do that because I don't know how to do that. Well, you know what? If they're a good bedside nurse, chances are they got those skills down. They can do the big P stuff really easily. The nursing process, it's a cycle. Define the issue. What's the evidence? What could possibly be the plan? What's the outcome that you want to see? Make the decision, implement it, and act on it. Doesn't that sound like the nursing process? Yeah. So it's not that it's hard, it's actually relatively easy. But we have to give people the confidence that it's something that they could do and in fact should do. So how do we get started? And we're going to do some of this today. As innovators, and many of us are, it starts by identifying what's a potential situation. Maybe you don't want to describe it as a problem because that's too negative. But what's something that you'd like to change? Where's there an opportunity to improve what we do for our patients? And we have to be careful in how we describe it to make sure we use words that people understand so that people, in fact, will be engaged and be a part of that without getting turned off because they don't know what you're talking about. I think sometimes people get turned off very quickly because of that first step. And maybe because of sometimes the emotion that people put into it and not just sticking with the facts. But identifying little p problems, I think, is relatively easy. If you sit and you think about the work environment and reflect on the work environment, think about, for example, just the RN satisfaction. And what's the list of which people are coming up with as to things that they'd like to see to improve their ability to deliver the best care possible? What's the barriers for them accomplishing that? Because one of the things that we have neglected as a profession is we've always focused on the patient, but we need to also be focused on ourselves. Think about this. Every time you get in that plane, what do they tell you to do with that oxygen first? On you. There's a reason for that. And the same, I think, is true in some of our work issues. We got to take care of some of the things for us. Some of the examples for big P and little p stuff that I think is important is that when you do talk to a decision maker or a policy person, a legislator, often we need to help them understand the importance of it, the data behind it, in a way that they understand. Again, it's that communication, it's that language. That stuff is all incredibly important. I think the other thing related to our policy journey and how we implement policy is that we have to keep the long view. Not everything's going to happen overnight. The Affordable Care Act was talked about in 1992 by nursing. Nursing actually created nursing's agenda for healthcare of the future. 1996 became a nice little document. 78 different national nursing associations signed off on it in 1996. and the Affordable Care Act got signed into law 2010. The long view becomes incredibly important. Clearly, at the end of the day, it's all about advancing our voice. It's about allowing our light to be seen. It's about allowing your intellectual capacity to make decisions that will improve the care that we provide. Thank you.